Well, if you're like most people that we encounter at SCAN, you don't know the difference between hospice and palliative care, but it's a big distinction. It's important for you to know. So today we're going to find out all about that. So stay tuned. Hey, good morning, everyone, and welcome to SCAN FYI. So our very distinguished guest today is Dr. Shira Goldberg. So good morning, Dr. Goldberg.
Good morning.
So anyone from SCAN who's been to any of our lunch and learns or our brain health fair, you may very well recognize Dr. Goldberg. So really, it is a pleasure to have you with us today. And you know what, Dr. Goldberg, just take a moment and briefly tell people a little bit about who you are and what you're doing.
Oh, great. So thanks everyone for listening this morning. So my name is Dr. Shira Goldberg. I started my career in geriatrics. So I'm a board certified geriatrician and was part of the geriatric practice for many years at Monmouth Medical Center. And then about 6 or 7 years ago, transitioned to going from part-time doing palliative care, which we'll talk about a little bit more soon, to full-time palliative care and as a hospice medical director for the VNA Health Group in New Jersey. And so I've been taking care of older patients for a very long time and have transitioned to really loving my job, taking care of the chronically ill and helping them live their best life through the palliative care services.
All right, well, I think we should really get right into it and explain what do we mean by palliative care? Because I do feel that from my observation from working at SCAN and going to many health fairs is that people simply, they don't know, they have many misconceptions, and I want to get through some of that today.
Sure. So the most important thing for us to remember this morning is that they're not equal, that palliative care is not hospice. A lot of people use the terms interchangeably, mostly because they're probably more uncomfortable with the idea of hospice and what hospice really means. And so palliative care has become kind of that euphemism for hospice, and so they equate them. But unfortunately, that really lessens the value and the creed to palliative care as to how we could help patients that may not be ready for hospice. And so if the most important thing is that they're not equal. Okay, so let's talk about what they are and how they're different. So palliative care is a service that provides care for taking care of chronically ill patients, not necessarily only older patients, although that's how I got to my career, through taking care of older adults. But chronically ill patients who have symptoms that are affecting the quality of life. It's a support for the entire community that takes care of that patient, their caregivers, their team. And the goal of palliative care is to provide quality of life, identify goals of care, help support that patient, even as they're going through curative therapy, perhaps, with all of their medical illness. So the big distinction between palliative care and hospice is that palliative care is meant for everybody. Everybody is always ready for palliative care because it goes together with whatever treatment you might be pursuing for your illness. It has nothing to do with how much life you have left or how long you're going to live for or how severe the illness is. It's really there to help patients focus on other elements that are important to them, like their quality of life, their family support, symptom management along the way of their illness. So I want you to think about, sure.
All right, first of all, I love that you said that this is not just for older people, because you can be 12 years old and have a life-threatening illness. So
100%.
Remember, to our listeners out there, this is indeed for everyone. But would you give an example of something that you might be going through that you would be in need of palliative care?
Great. So, a lot of people, the first thing that comes to mind for them is very commonly something like cancer, right? So a cancer diagnosis that you might be pursuing treatment for that cancer, might be going through radiation or chemotherapy or other agents, but you're having other symptoms like shortness of breath or pain or nausea and vomiting. And really palliative care would be there along your journey taking those treatments but working on making sure that your symptoms are managed throughout those symptoms, helping you identify your goals of care and your next of kin, and making sure that your legal paperwork that you need to take care of are done. But you're still going through those treatments. You're still going to your cancer doctor and you're still getting treatments for the cancer. But my role in that situation would be to help focus on the patient themselves, who they are and what's important to them, to make sure that those values are interjected into their care plan.
All right. Well, thank you for that, because I think that does clear up really, many misconceptions about what palliative care is. Most people who are going through palliative care are probably going to get better. Is that fair to say?
Many do, not all.
Okay,
right?
Many do. All right.
So what I want you to think about is, just like people are very commonly accepting that if I have a diagnosis of high blood pressure, I just need to take blood pressure medications for the rest of my life, right? And so that might be true of someone with a cancer diagnosis. Some cancers may be treatable, right, and curable, but not all are, depending on what kind of cancer and what stage they are. But that doesn't mean that if it's not a curable situation, they may not be going through treatment, right? And so they may continue to take treatment, but have symptoms that they need to control. And so the goal would be is, as they consider their cancer maybe like a chronic illness, just like their blood pressure, right? And so they need some help along the way to maybe take medications that might help them feel better as they're going through those treatments, right?
And palliative care would be, you don't have to be in a hospital situation to receive this, correct?
No, so there aren't that many palliative care physicians that are certified throughout the country, but the biggest pockets are in larger hospital settings, just by the nature of the specialty. But it is actually, the more important part of this is actually happens prior to them coming to the hospital, because the goal for those patients is not to be in the hospital, right? You only should be in the hospital for really emergency situations.
Yes.
Majority of the patients are home and dealing with those chronic illnesses on a regular basis, not being in the hospital that sick. And so a lot of the heart of what palliative care does is outpatient, seeing people in their home environments, in doctors' offices, alongside some of those specialists that they're seeing. It's a little bit difficult to find physicians who are certified in palliative care, although you guys are so lucky, because VNA has a whole crew of doctors that, see people in different environments, both at the hospital, in their own homes, at subacute rehab facilities, at nursing home facilities. So having the value of what the VNA system can provide gives people the opportunity to have access to this kind of care that is really unusual for, not everywhere in the country. And so that is a value for us, specifically in New Jersey, with the benefit of having VNA services there. But really the intention is to keep you out of the hospital, right? And to try to keep you happy and healthy and have the quality of life that you want in an outpatient setting if possible.
So because Dr. Goldberg, you mentioned about the VNA Health Group, and that they have this really a unique service, obviously, and we are fortunate where we live that we have access to it. So I've got that number for everyone up on the screen. If you wanted to call the Parker Advanced Care Institute, part of the VNA, you'll be able to reach out should you want more information, or if you or a family member requires this kind of care. Okay, that's important to know. So let's talk a little bit now about hospice, because it is a very different situation than palliative.
Absolutely. So remember, we said palliative care is appropriate at any stage of your illness. And should be referred just like any other specialist. You go, if you have a gastroenterology problem, you go to a GI doctor, right? So if you have a symptom management problem with a chronic illness, that's when you would seek out someone for palliative care. The difference is that you get to a point in your illness where curative therapy may not be possible anymore, or you've chosen, based on your goals of care, not to continue some therapies, or that you've chosen, when things are getting worse, you don't want to go back to the hospital, you just want to be home with your family. If your goals of care match the medical necessity that your illness is getting worse to the point where you would likely pass away from that illness in a 6-month general time, that's when you should start thinking about something like hospice. Hospice is meant for end of life care for patients who we will likely pass away from complications of their disease sometime in the next 6 months. So we're talking about a more of the end road for medical illnesses.
Yes.
Now it has to both medically, you have to be eligible for those services, that your illness is that to that degree, but also your goals of care need to match that wish, that you really just want to be home, out of the hospital, taking care, being with your family, just focusing on your symptoms, not looking for any of those curative aggressive measures that you were doing in the past. And when those two match, hospice could provide that service to achieve that goal that you expressed.
So what are the kind of things that people can expect from hospice care once they've made that decision to be part of that?
So for most of the members of SCAN, majority of them are on a Medicare system, I would assume, in terms of insurance.
So, yes.
Medicare provides a nurse that comes out to check on you, to help with your symptom management, to order medications as you need. There's an interdisciplinary team that arrives from hospice. So that would be a chaplain, a social worker, to help both you and your family members cope with the change in your life at this point. They do send an aide out for a few hours a week, but if you need full care, that is a whole different ball of wax. But it's there to help keep you in place wherever that place is. Hospice could be done in your own home, in a family's home. If home isn't a possibility, at a long-term care facility. Right. There are multiple avenues where hospice could provide your care. And the goal would be to take care of all of you, your symptoms, your quality of life, your emotional needs, to help you deal with facing the upcoming journey in your life.
I think it's really important to realize that you can have hospice care delivered to you in your own home, and because no matter what, there is no place like home. And you're addressing your mind, body, spirit. You're really you're making the end of your life as comfortable as possible.
Right. In medicine, we always talk about giving people the most autonomy to take care of their medical decisions. And with the way I want you all to think about it is considering something like hospice that matches your goals of care is giving you that same autonomy and control at the end of your days. You're deciding how you want that to look. Just the same way you decided all along the way which doctors you wanted to see and what specialists you went to and what medications you wanted to take or didn't want to take based on discussions with your doctors. So all those decisions you made along the way are now transitioning to just a different goal, right? Your goal now is to live as long as I have in the best way possible, understanding that time is limited, right? So that is unfortunately the situation when you're on a hospice program. But for whatever time that is, your goal is to be comfortable and in place wherever you are.
All right. Well, Dr. Goldberg, thank you for really giving excellent explanations. And, in a way that I feel that everyone now has a much better understanding of what is the difference between palliative and hospice, because they are very, very different. And remembering, too, that people of all ages may have this experience, not just for older adults. And I do want to mention that coming up in 2023 at SCAN, we're doing part 2 of a series called Planning to Live Your Best Life. And we are very fortunate that Dr. Goldberg will be one of the featured speakers, and there'll be more information on that in the beginning of the year. But again, Dr. Goldberg, thank you so much for being my guest today.
Thanks for having me.
Much appreciation. So remember out there, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on SCAN FYI. Bye, everyone. Bye, Dr. Goldberg.